We're very lucky today because we have Dr. Ann Schuchat from the Centers for Disease Control with us. She's the Assistant Surgeon General and Director of the CDC's National Center for Immunization and Respiratory Diseases. And Dr. Schuchat, we want to thank you so much for joining us again on the show.
It's my pleasure.
And how is the flu shaping up so far this year?
We haven't had that much disease yet, but that's normal. Usually it's February and March where the diseases can peak. So it's not too late to get a flu vaccine if you haven't already gotten one.
A regular year of the flu can kill up to 30,000 people in this country. Having said that, it can often be prevented with the vaccine. But I don't want to be an alarmist, Dr. Schuchat, but we've been reading reports about some cases of avian flu occurring in China. I was reading articles about how in a lab, scientists actually took a version of the avian flu and created a version that could go from human to human. Now, 60% mortality rate in China when it comes to the avian flu. Very few people have been infected, but this scares me as an ER doctor. Where do we stand right now in terms of our readiness as a country if this did become a pandemic?
We're keeping our eye on it. We're doing surveillance. We have vaccine stockpiles. We have a lot of efforts going on to make sure that if the strain does acquire the ability to spread easily, we can limit the impact that it has.
And Dr. Schuchat, that actually brings me to one more question. Do you have any new recommendations or new things for pregnant women to waylay that fear that they have of getting the vaccine when it is so important for them?
Yeah, more and more women are getting vaccinated during pregnancy, and we have a very good safety record for the vaccine. This year, we think almost 50% of pregnant women have been vaccinated, and it's not too late if you're pregnant to get vaccinated against the flu. We saw how serious influenza could be in pregnancy, especially during the pandemic, and we really want to prevent those complications. Women should know it doesn't just protect you, but it protects your baby for several months after birth. So I strongly recommend every woman who's pregnant to get the flu vaccine.
So, Dr. Schuchat, we want to thank you so much for coming on the show and for all the great work that you do.
Thank you.
Thank you.